All right, everyone. And I am joined by two experts in the medical space. We have Dr. Italo and Dr. John on the news and journalistic side with reporting, and we're talking about COVID. There have been a lot of things that I've seen in medicine, and that's been a topic of conversation around so many different issues, especially disparities in health. So, one gentleman, I just want to start. You can kind of introduce yourselves to the viewers and tell us where you guys are from and where you guys are practicing medicine currently.
John, you want to go for it?
Sure. I'm Dr. John, just so there's no confusion. I'm born and raised in Los Angeles. I went to med school down in Orange County at UC Irvine after completing undergrad there as well. I also obtained an MBA while I was there at med school. So I actually have 2 degrees, an MD, MBA. Did a lot of work at UC Irvine with our diversity efforts there in terms of recruitment and also working in the community with regards to outreach, primarily through SNMA, which is Student National Medical Association. So we did a lot of stuff out in Long Beach, for example, working in elementary schools and whatnot, trying to let kids see us at an early age so that they can know that it is possible to be physicians. That was some of the work that we were really proud to do. After completing medical school, I did my intern year at UC Irvine in internal medicine. I matched anesthesiology at Stanford. So went up to Stanford to do my residency, which is where I met Italo. Well, we met through social media first, and then met him after realizing he was there. So I did that. I just finished on June 30th of this year, actually. And now I'm down in Los Angeles again, because I'm going to be doing a fellowship, which is, continuing to further specialize in anesthesia and acute pain medicine. So regional acute pain medicine. I'll be doing that at Cedars-Sinai. So that's currently where I am right now.
That's amazing.
And the brother's track record is impeccable. I am Dr. Italo. I go by Italo, originally from Sacramento, California, born and raised. I kind of crisscrossed the U.S. for my educational journey, went to Morehouse for undergrad, popped up to Boston University for grad school, where I pursued public health and worked in public health for a couple of years before I got into post-bac in medical school at Meharry Medical College in Nashville, Tennessee. And then I trained in the Boogie Down Bronx at Jacobi and Montefiore in emergency medicine. Wasn't enough for me, so I decided to go one more year and get a further specialization in social emergency medicine, which is a fancy phrase for understanding health disparities, social determinants of health, and how those interact with the emergency department. So at Stanford, that is where I met John, and the brother has a presence there. And we had mutual friends prior to actually meeting, and then social media became the catalyst for us connecting.
Beautiful, beautiful. This campaign.
I should mention, Raina, really quickly, I actually did a post-bac as well. I did a post-bac at UC Irvine as well. We can talk about why I did a post-bac and some of the things that, went into that if you want. But yeah, I also did a post-bac too, so.
I love that. Educated men helping our communities and giving back. We're talking about disparities. What really captured my attention is this campaign that you guys put out maybe about a month ago now, I would say. Very powerful, where you had medical professionals from all different backgrounds, ethnicities, races, genders, talking about the importance of addressing disparities in the healthcare system across the board. And I thought it was very powerful, because that's not something you often see displayed. It's something that it's an ongoing conversation that I have heard at the kitchen room table in the Black community, that there are disparities, but to see it acknowledged on a platform so wide and so broadly, I felt was really empowering. So one, let's talk about the campaign itself. What is it? And how you both got involved in this.
Go ahead, Italo.
Oh, okay, sure. So essentially, this the last few months have been tumultuous. We were on in the substance of COVID, which is one full pandemic, and then the elements around social injustice, police brutality, and the desire for police accountability kind of came to a boil. And we had already done a few campaigns collectively trying to just increase awareness of disparities among ethnic minorities related to COVID-19 and related to general health and wellness. Then when police brutality kind of came to that full boil, I would say that everybody was moved in a specific way, in a way where it was now like an immense sense of urgency. And so John kind of had this concept where he wanted to make a clear statement from the medical community, because historically, we as clinicians have straddled the fence here. Like, we struggle to outwardly make racism and police brutality and elements thereof a clear public health issue. And so to kind of push that momentum forward and to make a definitive stance, I think John came up with this concept of, let's do a viral campaign. And I think that the major portion that I got from it, it's at least from the side of a clinician, is that we were pulling clinicians who were from in their own silos across medicine. So not just from the specialties of emergency medicine or anesthesia, but from all types of different specialties and all different walks of life and backgrounds, all genders and orientations, to outwardly make a statement against these particular racist views.
And Dr.
Yeah, it's really interesting how we all came together. Just sort of taking a few steps back when we were talking about how Italo and I, essentially how we came together through social media, and then also how our relationship sort of developed over the last few months that we were at Stanford. Before that, a group of us realized, one of our buddies, Earl Campbell, he started bringing guys together. During the pandemic, we realized, okay, a lot of people are at home. This is a great opportunity to sort of get messages out there, right? There's not a lot going on right now. So this is like very, very early on. So they start this campaign, put out this video, allow us to see, brothers, Black men in a positive light, as opposed to just always seeing us as, whatever people, stereotype us as. It's like, all right, you can see what, some of us male doctors are doing, right? That started, as sort of like a campaign. I think there were maybe 8 to 10 people involved with that. And now we have this group where there's many of us that are basically have come together through social media, and we're constantly trying to figure out ways to collaborate and talk about these issues, but more than that, actually sort of come to some sort of, action items, or really trying to get us to, to move on these things. So, and that's really important to mention, because one thing that we realized with this pandemic and, with the social and racial tensions is that, these are not Black and brown issues alone. Like, we didn't create these problems for ourselves. These things are problems, like I mentioned to you before Italo came on, that pre-existed us. And frankly, unless we do something about them, they're going to continue to be problems for our communities, even after COVID is done, this pandemic is done. So we started digging deep, really thinking about, okay, so why? Why are these things happening? Going back and, really looking at these things, talking about, going way, way back, systemic racism from its inception, really looking at how slavery, impacted how we have these toxic relationships with authority in terms of police and the issues that existed from slave patrols. And then fast forwarding to redlining and segregation, and thinking about how our communities have been stripped, for many centuries and decades, with, from having adequate resources, whether it be education, finances, economic resources, whatever it may be, and how some of these issues actually impact us from a health standpoint. And, really, really looking at it from a holistic standpoint. We have guys who are, psychiatrists that are looking at the mental health aspects of this. We have people like, Italo, who's on the front line looking at who's coming in and out of our hospitals, because the emergency room is the gateway. People like myself and others who are, in the ICU or critical care areas, and really trying to think about, why is it, why? It isn't just enough to say that Black and brown people are the ones that are primarily impacted by this virus, without telling people why. And so we started really thinking about these things, and that really sort of like allowed us to have a voice where now people are, really looking for us to speak on these issues. We have guys that are being put on various different platforms. Italo's done some work with big organizations. Other members in our organization have talked with Fox News, and, have talked with Oprah's network, have talked with, I was able to talk with Reverend Jesse Jackson, with some other folks as well. And really, this is an opportunity where people are looking for us to actually, speak and help figure out, what to do in this situation, which I think is something that we haven't had, frankly, in a while. We haven't had a platform like this in a while, because the whole world has actually been shut down. And a lot of attention now has to be paid to these things, right? Because there's really nothing else going on So we can no longer play dumb or ignorant to these issues like we have in the past. And I think that's quite frankly one of the reasons why this discussion is being had right now. So it's been a very interesting, I'd say, last 3 or 4 months. I mean, to be training myself, I mean, Italo was done with residency, but to be a resident and have my entire resident experience completely like flipped on its head. And it's not just me. I mean, there's obviously people who have had much worse experiences than we had. I mean, we were fortunate in the Bay Area that things didn't get really bad, but our colleagues in New York and other areas had very much so traumatizing and very interesting experiences with COVID and whatnot. But you know, honestly, the entire experience we had was completely shifted and turned on its head. We're now like, we're having to face these issues in ways that we hadn't before, having to talk to leadership and, you know, people who are primarily Caucasian males, you know, leading all these efforts in medicine, because that's kind of how things are still, you know, really having to talk with them and have them understand, okay, so here's, you know, gave us the platform. Here's the platform. What do you want to tell us? How do you want us to deal with this? It's been a very interesting last 3 to 4 months.
I would add one more piece to that. There was a need for support. We needed to support one another. And I think that out of what was seemingly inorganic came something very beautifully organic. That was, we knew that every single last one of us played a significant role in our communities as well as our academic ecosystems. And we wanted to build out of that. We knew we'd be looked to as thought leaders in those spaces. And we understood that when it came to understanding, we understood that when it came to diversity and inclusion and equity, we would be the best figureheads and spokespersons for that in those spaces. So I would say that anytime you have a group of individuals who are like-minded and mission-oriented, who lean on one another for strategies and support and to offload disappointments and anger and filter through emotions, as well as give each other strategies for coping. And it's something beautiful that will come from it. And I think that was the highest yield thing out of our consortium.
I love that. For people who have not seen this campaign and are wondering, what are we talking about? Can you guys describe the campaign to them and tell them the name of the campaign?
Yeah, well, I mean, essentially what we were trying to do was we were trying to find people throughout the states here, like Italo mentioned, who work in various different capacities, at different varying levels, have different specialties that they represent. And you know, frankly, that, you know, we wanted a group that was very diverse. Now we have a good representation from the African American community, which was the intent, but we also wanted to bring in folks and really invite them into this space and allow them to be vulnerable and really express how they felt as well. So what we were trying to do was trying to get people to you know, really be vocal about what they wanted to see, what change that they want to see come from, you know, everything that we're doing, right? It's one thing to have signs, it's one thing to talk about, you know, all of the issues. It's another thing to actually talk about, like we said, action items and really trying to work towards change. The easy part is holding up signs and saying Black Lives Matter. The hard part is actually really talking about things in a way that allows us to see sort, you know, what, like, okay, so today this is how it is. How do we make sure it's not like this tomorrow, you know? And so what we did was we gave everyone the opportunity to basically, you know, say whatever it is that was on their heart. Like, I want to see, I mentioned that, you know, there's an issue with regards to representation of African Americans in medicine. You know, there's only about 5% of American physicians who are African American, and the number for African American males, frankly, is continuing to go down. It has for a while now, and it's really a startling statistic when you start thinking about the domestically born African American male too, which is really important to harp on. You know, that number is dwindling, and it's not, and there's a lot of reasons why, but, you know, we can go into those later. But that was mine, you know, wanting to see more African Americans in medicine. And Italo mentioned, you know, what he mentioned, and others mentioned what they mentioned. And so our whole point and our whole focus was to bring attention to the fact that we wanted people to express what they wanted to see change as it pertained to some of the racial issues, systemic racism issues that we have in medicine. But we allowed them to speak on whatever they want. I mean, there are people who spoke on things outside of medicine as well, but that was primarily the goal. And so it worked out really well, actually. You know, it was very well received. You know, many people, you know, gave us a lot of, positive feedback as, you know, with regards to the campaign. And sort of that campaign led to many other things down the road. We had some conversations with AHSM, which is an organization that's involved with trying to help physicians or, you know, people in healthcare navigate the social media space and really, you know, do it in a way that obviously won't jeopardize their careers and allows us to sort of like propel our voices in a way that continues to promote positivity and actually fighting misinformation. We went on to have conversations with them and all of their members, which are people who are frankly younger than maybe some of the leaders that are currently leading right now, but very much so on a track to lead in various different ways very soon. And so they were engaging with us and trying to figure out, again, how is it that we can be better? Like, what are some of the things that we can do to, you know, amplify Black voices, but not just that, you know, make it so that the communities or the environments that we work in are supportive for, you know, those who are, you know, having these issues that we're discussing now. So there's been so much that's come from this, and it was just sort of like a you know, just the decision that I had, you know, that I made with one of our other brothers, Jamie Rutland, and a guy in the Bay Area who's involved with some IT work. He does a lot of you know, work, videography and various different other things with different organizations. So we came together and said, hey, let's make this video, and it came out to be pretty good. So
nah, it is phenomenal when you watch it and you can see how there is uniform buy-in across various genres of medicine and groups and classes of people, or rather ethnicities and identifications of individuals. So I thought that was very well executed. The thing that I hoped and I started to see come from it was normalizing the conversation around equity, because as physicians, this is essentially like a taboo area for us. Like, we are taught it, we understand what it means from a kind of a conceptual stance, but we don't necessarily throw our weight behind it. And medicine is somewhat malignant in that regard, where we fight for it for our patients, but we don't want to touch it with a 10-foot pole when it comes to like necessarily protesting or finding a way to demonstrate that you support social justice issues. It's not even taught in our curriculum. So I think that became a salient point, was like, you have people who are willing to see you, but not just see you as a patient, but literally see you. So you feel recognized and acknowledged, and they're willing to come to bat for you.
Yeah, I think one of the big issues with medicine is that we try to maintain a sort of level of neutrality where we don't, you know, bring our biases in when we're seeing patients or when we're working with folks. But that's actually a misleading thing at the same time. It's not really truly honest, because we all have biases in us. You know, we implicitly, you know, we do things and we see the world in different ways. And unfortunately, you know, the way that we were brought up and the way that we view the world has been shaped by, you know, many of our experiences that we have, which frankly, you know, you're at an area like Stanford and Palo Alto, where the communities that Atalo and I are very passionate about doing work with, you know, these communities are not communities that are very well represented in these areas at all, right? Because it's very high affluence, and, you know, there's just, you have to go a little bit further out to the, you know, to the borders in order to be able to see these communities. So you may not come in contact with people like we're talking about and really understand the world that we live in. And that's not a fault of yours. And that's one of the biggest things, letting people understand that, like, we're not blaming them for systemic racism. We're not blaming them for slavery. I know some people feel very defensive about that. And the reason why is because, you know, something, you know, you feel wrong about the whole situation, but everyone is living their life to the best that they can. And I like to give people the benefit of the doubt for the most part. So you live your life doing the best that you can, but now, like, this has been thrown into your face, and you're like sort of questioning all the things that you enjoy and everything that you do. Look, no one's blaming anybody for what's going on. What we're saying is the status quo can no longer be acceptable. We can no longer play ignorant to this, because it's right in our face. It's always been in our face, but now it's in our face in such a way that, like, we actually have nothing else going on right now because of this pandemic. And I don't want to say that lightly, because obviously there are a lot of people who are hurting, you know, in many different ways. You know, this is financially been very troubling. This is health-wise, you know, physically been very, very troubling, and mental health-wise as well. You know, psychologically it's very, very troubling. But I say that because right now, you know, a lot of things that we're talking about, the voices that are asking to be heard, are being amplified in ways that, you know, it's just impossible to avoid any longer. And so I think for us, like, you know, really helping people in our organizations and leadership particularly understand that these things are happening all the time. I mean, when we share our stories about some of the things that we experience on the wards, in the ICU, I'm sure Talo experienced in the ED, patients, colleagues, sometimes malicious, sometimes not, say things, do things, microaggressions, implicit bias, there's things that happen. And, unless we bring them to light, many times they're shocked, like, oh my God, I can't believe it. It's like, yeah, this happened to Stanford too. Stanford's not immune. It's not like it only happens in the hood,
Right.
like these, we have issues with some of our police officers, even here in the Bay Area, and it isn't to say all police are bad, it's just to say that this is unfortunately something that's rooted in the system. And I'm very passionate about organizational culture and behavior. That was one of the areas of my focus in my MBA. So talking about diversity and culture and teamwork, all these things that are really soft things are things that we just don't talk about enough in medicine. We don't get any training in these areas at all. You get a long white coat, you're told you're a leader, and you just get sent out there. And when you add on all the stresses of the job and all the things that you have to do, it doesn't give you the opportunity to really think about how to be an effective leader. And unfortunately, that's an area where we're still lacking. And these are things that actually contribute to that. In order to be an effective leader, you do need to have an understanding of all of these things. But unfortunately, medicine is just still pretty far behind when it comes to, dealing with these issues.
And it was so captivating, the campaign, for me and my experience, because we all go to the doctor. We all have to see the doctor at some point within our lives. If you're not going to the doctor, maybe you're eating your 2 apples a day. I don't know what the saying is. But for me, being a Black woman who has had to go to the doctor, I feel like there have been many times where often my concerns have either been brushed aside. The last doctor's appointment I had, I was told I worried too much. And I feel like, that's not the case. I feel like, you should not be made to feel like your concerns are dismissed. And I mean, we could sit here and lay out the numbers of, the mortality rate for, Black women who are pregnant, or a number of other disparities. But instead of focusing on that, because, we know the numbers and we know the research, what moving forward do you feel like you hope this campaign and this conversation starts? What changes do you hope will come from this, and start the conversation and move us forward?
Well, I think that there's a couple ways to look at this, right? So one is, as a patient or as people who are accessing healthcare, you can have expectations for your providers. You can absolutely have expectations of the doctors and of the healthcare system to acknowledge your existence, to be equitable. And I think that the pressure that comes from the patient side should also follow with where you choose to go, where you spend your money, right? So if you can link that desire to metrics, to saying like, hey, you definitely need to show us that you have a commitment to diversity, to commitment to improving health outcomes in our communities, a commitment to our communities by investing in those communities. You can demand those things. The second thing is, on the provider side, you have to be transparent with one another. Like, let's talk about it. Let's have the conversation. Let's say how difficult it really is for you all to, and I say you all, I mean providers in general, to foster a culture of equity and more so diversity. When you say inclusion, do you really mean it? Are you putting your money where your mouth is? Let me look at your boards. Let me look at your leadership. What do they look like? Does it reflect a true equitable distribution among all cultures and races, and all genders and all identification statuses? I do think that it's important to call out your colleagues, but not in a way that is judgmental, and more so in a way that is like, we're going to hold each other accountable and make a plan. So that, I think, is a provider side thing. And then on an administrative or organization level, I think that you have to create dashboards and use data to drive those things so that people don't feel like you're hiding it from them, because that's essentially what the anger is within the system. It's people feel like they're not being heard. And then those that are in power saying, we hear you, we're doing things, but we never know about it. And we don't see the funds or the actions or the outcomes that follow and that support your statements. So organizations, specifically administrations, have to be very clear about what they're capturing, who they're hiring, how they're doing it, is it equitable, and share that across all platforms to individuals who are the patients as well as the people who work there.
Yeah, I mean, I think Italo and I, we think very similarly because we've had many discussions over the last, like I said, 3 to 4 months on this issue. So a lot of the points he brought up are all points that I 100 agree with. The the interesting thing about sort of like what do we do about this is, like you said, I think we really have to focus on certain areas that we want to address, to really look at it from a global standpoint. Really the whole, trying to attack the whole system is going to be, quite frankly, a big challenge. I don't think anyone's going to successfully navigate that very well. I think focusing on specific areas, I know, for example, on an institutional level, the departments at Stanford, my department, I'm sure he tells as well, because I know some of his, leadership in emergency medicine, what they're passionate about. They're all trying to figure out, okay, so now that we, have all this that's been brought to our attention, that's just sort of in our forefront now, what are we going to do now? And how are we going to, make sure that, like I mentioned, tomorrow is better? And like he said, I think if you look at UCSF, for example, one of the things that they're doing over there, which when I interviewed there, I was actually really impressed with, is they took a giant inventory of their entire, ecosystem. They really, from a diversity standpoint, looked at everything. They went from students all the way up through faculty, and they went back, over a certain number of years to determine, okay, so what are our numbers? Like, how are they trending? What are we going to do about diversity? Like he mentioned, like not just money, but like what resources are we going to put forward so that we can actually start seeing some sort of change? And they track those resources. They track all the progress. They track everything. And then now they make an annual report every single year that basically, showcases or highlights all the things that they're doing from a diversity standpoint and how it's been impactful for their ecosystem and their communities, and how they're recruiting and retaining, and what sort of projects they're investing in. All this, it's phenomenal. And I actually brought some of this attention to Stanford leadership as well, so they can actually see it. These are the kind of things that he's talking about from an institutional standpoint. It takes effort, it takes energy. There's an activation energy that's necessary, and then that's really sometimes the big hurdle, is really getting people to actually sort of start, investing and looking at these things in a way that they've never done before. And having leadership that's really passionate about it and invested in it is a big key. But then the momentum that's necessary to keep it going, so that it doesn't just become a fad, it's in and it's out, is very important as well. From the community, I think one of the biggest things is really having people understand that, like I said before, we didn't create these problems for ourselves. A lot of times there's these stereotypes or these thinkings that, African Americans like work themselves into poverty, that we're not interested in getting out, like we're lazy, we're just trying to be on welfare, when we know that the statistics, and as Italo can discuss from a public health standpoint, there are actually more Caucasians on welfare than there are African Americans on welfare. And I'm not saying that as in like, let's make this a black versus white thing. I'm just talking about in terms of statistics. We represent 13% of this country. It's probably a little bit higher. I bet there's some that, some of us that maybe didn't actually contribute to the census. And, there are many reasons for why we don't go into this, we don't, participate in the census, why we don't vote. There's a lot of, issues with regards to some of the oppression that we've been talking about before, and how these systems continue to hold us down. But I think when it comes to representation, we have to ask ourselves, why is it that we have these numbers? Like, why do we only have 5% of African Americans represented in medicine? And in the state of California, where we know there's a lot of African Americans, why are the numbers so poor for our medical schools? Like, why is it I can go to a school like UC Irvine and be one of two out of 100 blacks that are in the medical school classes? This is a problem. But I think really what it's going to come down to is, as Italo mentioned, is we're going to have to address these issues by not just protesting and walking on the streets, but we actually need to get our national and local officials to implement policy change. And these are things that obviously John Lewis fought for. May he rest in peace. These are issues that he passed to us that we're going to have to sort of take that baton and continue to fight for, because until we see some sort of significant changes in our communities, where we're actually investing in our communities from an education standpoint, really trying to fix this issue of, depending on whatever zip code you're born into, that has a significant impact on where ultimately you may end up later down the road. Whether or not you make it or not can really be traced back to what zip code you're born into. It isn't to say that only people who are born in areas, 90210 Beverly Hills are only ones that are going to make it. No, that's not to say that. But the hurdles that you have to jump through and over, coming from various different communities, are significant, and it could be extremely discouraging, right? You go to a school where, you may not have a lot of honors and AP classes, or you may have a student to teacher ratio that is like 50 to 60 to 1 versus like 10, 20, whatever to 1. These are all issues, and after school programs and tutoring, programs and all these things. Like, how are we going to make sure that we have these pipelines that are created that help, shuttle our next generations through so they can actually get to this point. And we're not talking about affirmative action, which is a tough topic for many people. We're talking about actually like blowing up the system. And I know it sounds radical, like not literally blowing it up, but like really saying, look, this is broken. We got to fix this. Our system that is not working for our communities in ways that we needed to, so that we can actually make sure that when patients are coming to the hospital, they're able to open up and feel comfortable. And these relationships that are, quite frankly, in many instances, toxic, where there are minorities, like African Americans, that go into, as you mentioned, into the hospital, and they just don't feel the trust or the love, or they don't feel like they can be themselves, because it's just a relationship that has never really felt like one that works for us. We need to do better in these areas. We need to make sure that we're well represented in the hospital. We need to make sure we're well represented in medical schools. We need to make sure we're well represented in leadership, that we have more people like myself and Italo that are out there being pushed and trained to help sort of be a part of some of these discussions to make change. Like, we can't just rely on the majority to make the change. We actually have to be a part of the discussion, but we need to recruit them, because frankly, we can't do it by ourselves. So this is a multi-layered issue, but I do agree with Italo that it's a system issue, it's a community issue, and it's also a person issue too, right? We have to look in our own hearts, and the only person who can do that is you, right? Like, we have to all be open, to being more vulnerable, allowing ourselves to sort of have these discussions with folks in ways that is very uncomfortable, frankly, very uncomfortable.
I think that you said something that is that was understated. Black and brown people are not looking for handouts. That's not the MO here. The mission is not to get people to feel some degree of sorrow for us, or to be so, like we must give some grand charity to this group of people. That's not what we're looking for. That is the misconception, and it's something that we're trying to debunk. In fact, using the term equity helps people to understand it is not charity. It is something that is legitimately, you are born into this potential right or responsibility. It's not just one-sided. You are definitely granted this if you are a certain color and you are of a certain racial breakdown, a certain demographic. And then if you were in another one, you are not granted this. So we're talking about the right to that and the responsibility, if you are a person who has access to it, to make sure or ensure that it is equitable. And I think that is a part of the misconception. If we can figure out how to have that conversation in a way that the people who cringe still don't leave the room, if we can figure out how to have that conversation in a space where the people who are pissed off to high heavens don't leave the room, and find a way to diffuse that anger. And if we have if we can find a way to have that conversation in a way that the tears that are shed basically become the soil or the fertile material that we can build out of, I think then we'll be fine. No one wants to take that journey. No one wants to take that trip, because it is painful. And it means that on both sides, there will be trauma. So as we kind of like prepare ourselves to do this, and as we as physicians kind of approach this, we're no strangers to trauma. We're no strangers to experiencing, moments where it was just unsightly things, whether it's visual stuff or our own walks through medicine. It makes us prime ambassadors for this conversation, because we have to tell people that their parents have died. We have to tell somebody that, deliver bad news all the time. We don't have the luxury of leaving from difficult conversations. And that's why it's so surprising to me that physicians are not in the front lines of this conversation, because we're always down to be the ones to take the news of someone having a cancer to the patient and try to help them from there. Well, there's entire races of people who are, at the detriment to society, and they're looking for someone to advocate on their behalf. As physicians, that's what we signed up to do.
And this is how it all begins, the conversation from you both, Dr. Italo and Dr. John. Thank you both so much. How can people find you and stay in touch with you both?
I think social media obviously is a great way now. We all have public profiles now. I think that's also something that's changed greatly, is that physicians have taken much more active voice. You know, we now have a much more active voice on social media, where before it was maybe like you can't be a social media doctor and all these things. Like, I think for us, like being open and allowing our profile to be open so people can see us and you know, really get to know us has been very much so impactful. And if I had that when I was coming up, man, it would be a huge thing to have someone like Italo to look up to. So I want to make sure my profiles are all open, so the next generation can see that, you know, you can wear a hat, you can be someone who's, you know, maybe not the traditional looking or doctor or whatnot. Hey, I'm that person. You know, I didn't have a traditional route. So come find me at DocJP3 on Instagram. I'm also on TikTok as well as DocJP3 on Twitter. DocJP3 was already taken, so I'm actually Dr. John Patton on Twitter. It's a little bit more formal, but those are the 3 platforms that I'm primarily active on. I don't have a YouTube or anything else. Those are the three areas you can find me.
Perfect.
I definitely echo those sentiments. I would love it if any young person who's aspiring to be a physician or interested or just wants to know how they can navigate these issues of social injustice, reach out to me. I'm at GR8 Vision. So Great Vision on all the platforms except for Facebook. It's just my name, Tyler Brown.
Yeah.
Thank you so much for this conversation. I appreciate you both, keeping both of you in prayer. And until we have our next conversation, because this is important. This is the first of many. It won't be the last. Take care, gentlemen.
Thanks so much.
I appreciate your time.